I first heard the term ketamine from my friends telling me that they had tried horse tranquilizer, and my immediate reaction was, why would you try that for fun when it's used to tranquilize horses? But it turns out it's not exactly what the name implied. In fact, when using the drug in a clinical setting and getting it administered by a professional, the drug can have immense benefits on the neural pathways of people with brain dysfunctions. As a psychology major, I am extremely interested in the field of mental health and how our physiological psychology affects our mood and behaviors. So earlier this year, when I heard the FDA approved of the use of ketamine to treat neurological imbalances, I was amazed. Today, I will focus on the most common use of ketamine to treat depression. First, talking about brains, then talking about how ketamine interacts with brains, and lastly, talking about how the administration of this drug. So let's discuss physiological psychology, or to put it simply, let's talk about brain science. So we have a bunch of nerve cells in our brains called neurons, and they communicate with each other by sending little messengers called neurotransmitters through a little gap between each neuron called a synapse. And these neurotransmitters tell the next neuron whether or not to become active. Common examples include dopamine, serotonin, and norepinephrine, stuff found in EpiPens. In 2017, the World Health Organization reported that depression is the leading cause of disability worldwide, but no one really knows what the cause of it is, or nor exactly how to cure it. The leading theory is exemplified in Brian Leonard's academic journal, where he found that in patients with depression and in the post-mortem brains of suicide victims, that there was a serotonin release dysfunction in certain brain receptors, implying that low levels of serotonin neurotransmitters are associated with suicidality and depression. Yale medicine psychiatrists call this implication the serotonin hypothesis, and it's what led to the pharmaceutical pursuit of antidepressants called SSRIs, serotonin reuptake inhibitors, which is a fancy way of saying pills that keep serotonin in the brain. They also said that this hypothesis didn't fully explain depression. SSRIs offer limited help to more than a third of people with depression, and growing research shows that the neurotransmitters that these antidepressants target, like serotonin, only account for less than 20% of the neurotransmitters in a person's brain. And the other 80% consists of GABA and glutamate. Jennifer Van Voort, a psychiatric researcher at the Mayo Clinic, the #1 hospital in the nation, reported that when we have depression, sometimes we don't have as many connections or synapses within the brain cells. So these synapses go away altogether. So for many patients with depression, SSRIs aren't effective for them because they don't even have enough connections in the brain needed for these pills to work. And that is an extremely simplified version of how the brain science behind depression. So let's move on to how ketamine is able to treat it. Ketamine is a multifunctional Schedule III drug. It can be used as an anesthetic, misused recreationally, and as of March 5th, it was approved as the first truly new medication for major depression in decades. The functions of ketamine are different on a molecular basis. According to Robert Meisner, a medical director of the ketamine service, the anesthetic function includes two molecules, R and S-ketamine. The newly FDA-approved medicinal ketamine, named S-ketamine, only has the S molecule. S-ketamine interacts with neurons by binding certain brain receptors together and increasing the amount of an excitatory neurotransmitter in the synapses called glutamate. Dr. Meisner goes on to explain that increasing glutamate neurotransmitters means encouraging the activation of neuron signals, in turn increasing brain connections and essentially creating new neural pathways. The Yale medicine psychiatrists, pioneers of ketamine research, report that intense stress alters glutamate, making it harder for neurons to communicate. And they found that ketamine triggers the production of glutamate. And then similarly, Dr. Van Voort from the Mayo Clinic reports that S-ketamine is thought to create new synapses in the brain. So that's what researchers say about how S-ketamine interacts with the brain. So now let's talk about how it is used in a clinical setting and the effect it has on patients so far. Esketamine is a drug that is administered professionally. It is not a drug that can be used by individuals independently because of the effect it has on patients during treatment and because it can be easily abused. Dr. Van Voort reports that esketamine is prescribed as a nasal spray and that it must be administered in a clinical setting, and it's not for everyone. They have to fail 2 antidepressant trials at adequate dosages and durations to meet the criteria to be considered for esketamine. Clinical psychiatrist Christina Kusin says that ketamine is administered at a low dose, and commonly observed side effects include an increase in heart rate, blood pressure, serious cardiovascular events, effects on the respiratory status, and an altered mental status because of the dissociative effects. Many patients see improvement in their mental health within 24 hours of treatment and even immediately after treatment. People suffering from suicidality report the complete absence of suicidal ideation after treatment. In conclusion, I have discussed the dysfunctional brain chemistry and then how esketamine works to combat that, and lastly, the proper and safe use of this drug. The benefits of this new medicinal ketamine are immense. I recommend against self-medicating because horse tranquilizer is molecularly different from esketamine, but if you want to take a trip down the K-hole, I don't judge, just be safe. Thank you.